Hello, and welcome to my poster, How the Entourage Uses Online Information to Support Parents in Their Social Circle. This is the protocol for a mixed methods research study that is part of my PhD protocol. To provide some background, high-quality online health information and interventions targeting literacy improvement generally have positive outcomes for consumers. Example, being more involved in their own healthcare. Negative outcomes, such as having increased anxiety, can be reduced by discussing the information with someone in their social circle, i.e., their entourage. One study reported that almost two-thirds of online health information seekers search on behalf of someone else, yet little is known in the literature on the outcomes of this process. The objectives of my study are twofold. First, I'd like to measure and document the outcomes experienced by people who search for information for others in their entourage. And I'd also like to revise a theoretical model on the role of social support on online health information outcomes. This model was developed after the first part of my project, which was a mixed studies literature review. To provide some context, so this will be conducted in the context of an online parenting information website called NAPCRG, set in Quebec. The NNG, NAPCRG, implemented the Validated Information Assessment Method questionnaire since 2014. This questionnaire has been continuously updated and validated. The entourage in question in this study are entourage of parents with young children, and they are grandparents, family, friends, and neighbors, and they comprise approximately a quarter of completed questionnaires. I'll be conducting a convergent mixed method study for this project. For the quantitative portion, I'll analyze statistically the ratings provided by the entourage. As of last September, there were approximately 7,000 responses for me to analyze. For the qualitative portion, I'll recruit at least 30 entourage members who agreed to be contacted when they completed their questionnaire, and I'll be conducting phone interviews, and followed by thematic analysis of these interviews. The results from both portions of the study will be compared by a joint display. The results of this study will allow us to better understand how people share information on child development, education, and well-being, and what outcomes they experience. We'll revise the theoretical model and the validated questionnaire for the website. And in conclusion, this is an important topic for researchers, primary healthcare practitioners, and patients, because by better understanding how people use this information, we can then develop recommendations to help information providers adapt the information. And also, healthcare practitioners can then target the patient's entourage with information for dissemination and use. Thank you.